What's up, sportsmen students? Looks like sadly this will be our last kind of new content we're going to be learning. We'll be learning a couple more things after the seniors are done, but this is the main meat of it. Okay, so as you can see here, we're looking at basic injuries. Maybe some basic, some not so basic. But what the basic part of it is we're just talking about sprains and strains, just the general injury. We're not going to go into like ACL sprains or MCL sprains or Tommy John, the elbow. All right, so let's go through this. We'll talk about the injury, mechanism of injury, which is important, signs and symptoms, and then treatments. So sprains are injuries to ligaments, right? Ligaments provide stability, right? So that there's a couple ligaments probably torn there. MOI is like a forced movement, right? Like right there. What's his name? Joakim Noah. He didn't try to do that. He was like forced into that. These are the grades. So grade 1 is minor stretching of the fibers of the ligament. 2 is a partial tear. Grade 3 is a full tear. And now look, if you play with the grade 1, it's weakened, right? So that could turn to a grade 2 and a grade 3. And that's what I think a lot of student athletes, they definitely want to play, but it's our job to educate them that like, hey, look, this could go bad, right? And so on. Or it could get worse. Sprains continued. So signs and symptoms. So grade 1, so you might have some hyperthermia, tenderness to palpation, maybe some decreased range of motion, but overall not too bad. Grade 2 or 3 is where you start to see more of the symptoms, the ecchymosis, the erythema, and really the decreased range of motion and decreased. WB stands for weight bearing. We'll call that the first extra credit of the day. What does WB stand for? Weight bearing. Sprains are treatments for sprains. So Rice, I think we talked about this, right? But there's some studies starting to come out that say you shouldn't ice. We'll just do extra credit number 2 here. So there's some studies coming out that saying you should not ice right away, because it stops the body's natural healing response, right? So the body's natural healing response is to make increased blood flow to the area. And when you ice that, you kind of stop that. So there are some studies saying that you shouldn't do that. It's just starting out now with some evidence. So I'm not changing my practices yet, but I wouldn't be surprised if it did. So extra credit number 2 is they're starting to say that you shouldn't ice now because it stops the body's natural healing response. NSAIDs is like Advil or ibuprofen, non-steroidal anti-inflammatory drugs, and then progression to rehab. Strains are to muscles or tendons. Forced movement here most commonly is definitely hamstring. Grades are the same as sprains. Symptoms, signs and symptoms are the same as sprains. It's when you get to grade 2 and 3 is when you start to see more, and you'll see a deformity like a divot in a muscle. I'm not sure if that's how you spell divot. Here are some deformities we're talking about, like somebody with the torn bicep tendon or a torn hamstring right there. Dislocations. So dislocation happens in a joint, right? So you have 2 bones, at least 2 bones that make up a joint. It's when those 2 bones get displaced, that's where you have a dislocation, right? And then someone has to put it back in. Now, you've heard of people subluxing before. Sublux is a partial or full displacement of bones, but then it relocates on its own, right? A dislocation, you got to go to the ER or something to get relocated. There are the signs and symptoms. Dislocations are painful. There's no doubt about it. Fractures, same as break. So a break is a fracture and a fracture is a break, okay? Fracture is just more of a technical term. And these are the different categories or types of breaks or fractures. Treatment, we want to splint them to decrease movement, send them to the ER. Typically 6 to 8 weeks for bones to heal. Concussions, concussions are a hot topic always. This is a kind of definition of what a concussion is. I wish we could get in more to it, in class. But it's easy, right? So signs and symptoms are a concussion is diagnosed based on symptoms. Signs and symptoms. If you get hit in the head and you have symptoms, you're going to be in concussion protocol. No activity. There is some PT you can do for that, a CT scan to make sure there's no bleeding, and then you have to do a 5-day gradual return to play progression, right? And as well as there's a lot of academic accommodations as well. Chronic issues are usually mostly just due to overuse. Anything with ITIS after it, so tendonitis is inflammation of the tendon and so on. This is overuse, muscular imbalance, lack of cross training. We have a lot of that. A lot of people just play soccer year round, basketball year round, just dance year round. You have to do some cross training to really strengthen your body completely, right? If you do the same motions over and over, you're going to plateau and you're going to overuse your body and you're going to cause chronic issues. These are really the signs or symptoms. Treatment for it, cross train obviously, but thermotherapy, cryotherapy, and rest. So that's just a quick little basic injuries. Right? Hope you guys got some information from that, and we'll talk to you soon. By the way, this is at Mullen, right? Bad ankle sprain. All right, talk to you soon. Bye.